Throughout all the different ways that the Blue Zone Project Bakersfield has manifested itself in this town throughout the years, a major focus has been in working with the healthcare industry in the hopes of getting both the people that work at hospitals and the people that go to hospitals the ability to live happier and healthier lives. In the hopes of achieving this, the Blue Zone Project Bakersfield and Adventist Health have been working together closely and have put together many different workshops and social gatherings known as MOIs, with the main goal being homogeneity and to strengthen the bonds between medical workers in the community. The style of these MOIs come in many different forms, from the more social, walking, and conversational MOIs to the more creative-based painting and knitting MOIs. In Adventist's case, the people helming these MOIs are simply the workers in the Adventist healthcare system themselves. See, these are just people who want to share their hobbies with their fellow coworkers. An example of one of these leaders is Amanda Swanson, the head of the aforementioned knitting MOI, who had this to share on the importance of community gatherings.
Where we invited people to bring their knitting and crocheting, and they could learn to knit or crochet if they didn't know how, or they could work on projects they had. So we met for an hour and people could drop in and knit. And it was really fun because we had people from all over the hospital who came, people from physical therapy, people from cath lab, you know, people that don't necessarily sit down and take breaks together and get to know each other. And we got to chat, and some people learned to crochet, learned to knit. The goal was that we would be able to make some hats for the Cancer Center to give out. So it was a really fun thing as far as team building.
Now, the MOIs are not the only way that the Blue Zone Project hopes to aid the hospital system. They also strongly believe in the idea of environmental healing and that serene settings help console the body without even realizing it. Because of this, there's been a huge push in recent years to allow for inviting infrastructure in the hospital that range from outside courtyards to more focused and appealing break areas, in the hopes of allowing for the people in the healthcare industry to be able to take a second off their busy day to collect themselves and finally relax. The biggest question still stands, however. Why do all of this? How does walking and knitting aid in a hospital's job to heal people? Well, it's important to think of a hospital and the people who work in it like a well-oiled machine. If you were to keep it running day and night, eventually all the little parts would start to corrode and break away. Taking the time to build these bonds between the hospital workers not only keeps them happy, but keeps them there. To show all of this importance, I spoke with Holly Otten, head of the Blue Zone Certification Initiative at Adventist Health, on her experiences that the Blue Zone Project has had on her campus.
It can be really challenging in healthcare to hold on to our clinicians, and so for us to have these kinds of stellar retention numbers is a huge testament to the power of what we can bring. We track also kind of like the culture within the organization, and we've seen a huge upward trend with the culture as well. We assess people on these surveys. We assess how we're doing with our culture, and so that's gone really well as well. And there are other things that there's actually a whole host of different numbers that we track kind of on like those turnover numbers. We look at these survey outcomes, and there's some other financial indicators that we look at.
Okay. So now we've seen where we are with the Blue Zones, but where do we go from here? To answer that, I sat down with Lisa Walford, member of the Blue Zone Committee at Adventist, to see where the future plans are with the Blue Zone Project and Adventist Health.
Projects, and we are in this transitioning period of, we've got our certification to where the managers and the leaders are now leading the team. We will be taking care of our employees, and as every employee is hired, we put them through and have them understand what the Blue Zone Project looks like. We also have developed multiple different MOIs within our hospital.
The biggest takeaway that the Blue Zone Project hopes to provide is the knowledge of the importance of health and community. See, humans thrive in social settings and begin to break down if kept in isolation. And unfortunately, we live in a more isolated time than ever before. And that is why we need to take that extra step to cognitively think for ourselves, to stop and smell the roses.